Hormone deficiencies, they're a problem for women of all ages, not just the menopausal. Symptoms, it can make you sick, tired, irritable, also kill your sex drive. But there is a book helping women take charge of their own health. It's called How Your Doctor is Slowly Killing You. And here with the 3 questions every woman should ask their doctor is the woman behind that book. This is Dr. Angela DeRosa. She's the founder of DeRosa Medical. We are so glad you're here. I mean, Terry and I are like, yes, let's just feed off of you, because this book is, it's a personal journey for you. What was your inspiration for writing it?
So I went through menopause at 35, which puts me in the category of premature ovarian failure, but I started having my symptoms when I was in medical school and residency, and nobody could help me. And in fact, they patronized me, patted me on the head and said, there, sweetheart, eat less, exercise more, go on a date night. It was very patronistic, and nobody could tell me what was going on. It took years of my own personal research to figure out what was happening to me. And the scary thing is that despite where we are now in medicine, we are still markedly deficient, and it was even worse 25 years ago.
And this book, what is the basis of this book? Because it's not a thick book, it's a quick read. What am I going to, what's the takeaway?
So this book was written for the patient. This is not written for the doctor, obviously, and it wasn't intentional to upset my colleagues, but it needed to be said that women are being put on medication after medication to treat symptoms of hormone deficiencies in menopause, and they are slowly killing women. And unfortunately, we get put on sleep medications, we get put on antidepressants commonly by doctors because they don't know what to do with us when we start having all these
diet
symptoms.
Pills and all that. So what are the 3 questions that every woman should ask their doctor?
Well, certainly you want to ask them, am I too young to have hormone deficiencies? And if they say no, you need to run right out of the door. The other thing is you want to make sure that they understand what labs to order and how to properly interpret them, because if they just order basic blood work and use basic lab reference ranges to interpret those blood levels, they are going to miss a ton of things. And then also, if you're getting treated, make sure you're on a bioidentical, meaning a molecule that your ovary makes, so it mimics what your body's making naturally. And also make sure it's not a pill form, because the second you swallow those hormones in pill form, they process through the liver, kick out clotting factors, which is where the danger comes in for clot risk. You avoid the liver, you avoid that risk.
But you know, our time is so limited. I mean, we go into a doctor, they're rushing us through. I mean, what are some time-wasting questions that we're answering that we could maybe just skip over those? What should we not be talking about?
Well, it's a little bit challenging. First and foremost, you need to do a full history, because when you're evaluating hormonal health, it affects you spiritually, it affects you socially, it affects you physically, it affects you mentally. If you have a doctor who's rushing you in and out in 5-10 minutes, you're also at the wrong place, because you can't possibly get enough information to make a good call. And a lot of hormonal discussions involve asking pertinent questions about your sex life, asking about your health, your mood, your energy. Are you gaining midsection weight gain? Are you ready to lash out at everybody? I call it the stupid people rule. Stupid really upsets you more than anything, and you just want to punch people.
Yes.
We got to ask those questions.
Right. Well, I want to go back to the question that you said about age, because you said no, but I think you meant yes. So if you ask the doctor, are you too young, and they say yes, you're too young, we should run, right?
Absolutely.
You said no, but I just want to. No, it's okay. I just wanted to clarify, because I know what you meant, because you were very young when you started.
Absolutely.
And you said that women, we really need to empower ourselves to take control of our health. How do you suggest we do that?
Ask the questions. Don't accept standard conventional wisdom, and most importantly, women know their bodies. If you feel that there's something wrong, there likely is, and if you're not getting the answers that you want or feel that you deserve, you need to evaluate the questions you're being, or the answers that you're being given. People are very intuitive, and when you talk to women, you educate them. So when someone comes into our office, we go through that whole history, but when we order labs, we sit down with you and we go through every single lab, tell you what we ordered, why we ordered it, and what it means. You should be highly educated as your own personal advocate, and you can only do that if you have information. All
right, so let's tool you with the information you need. Dr. DeRosa is offering our Sonoran Living viewers a free e-publication or Kindle version of her book. Just go to our website, sonoranliving.com, and we will give you a promo code for your free copy.